Unfortunately, for many different medical reasons, some people cannot be cured of their lung cancer. Some people find this very difficult to come to terms with. You may find yourself thinking a lot about treatments and why there is no treatment which could cure your cancer. Feelings such as sadness, anger, and blame are common and normal. Your doctor will be able to refer you to an expert team of health professionals called a palliative care team. Your lung cancer nurse will also continue to support you. They can help you and your family and will make sure that you have the best possible quality of life. Please remember, even though your cancer can't be cured, you may be able to live with it for some time and enjoy a good quality of life.
When I found out my lung cancer couldn't be cured, I felt shocked and horrified and numb. And I just saw my whole life sort of disappear within front of me. The first 3-4 months after being diagnosed with cancer was very difficult. I'd had the radiotherapy treatment and then I started the targeted therapy treatment. I had no knowledge of whether the treatment's going to work or not. So emotionally it was quite difficult to cope with not knowing whether the treatment is working or not. My eldest son had just started what we thought was an excellent career move. He'd got himself a job down at Doncaster, a flat, and then this bombshell hit the family that I'd got diagnosed with cancer. I knew that I wouldn't be able to carry on doing the physical work on the farm. So sort of a lot of tears were shed. It was quite an emotional time. I asked my eldest son whether he wanted to come back home, run the farm, carry on the family farm. And I said to him, I remember saying to my son, please don't come home unless your heart is in it. And he said, yes, I want to come home to run the farm for your dad. The advice I would give is don't bottle it up. The worst thing you can do, let your close family know and close friends know. So you've got support out there. Certainly my close friends have been a support to me. My wife, I don't know how she's coped with it. I mean, she's had one catastrophe after another in her life. Her mother died 4 months before I got diagnosed, and then having to go through my diagnosis as well. You just need to get as much support as you can. Try and remain positive and try and keep yourself occupied as much as you can, even if it's I went and bought myself a laptop because I found it very difficult to sit in a chair. I went and bought myself a laptop so I could lay on the bed and where I was comfy and keep in touch with the outside world through use of a laptop or even a mobile phone. It keeps you in touch with the outside world. I was still able to run the backbone of my business from where I was, even though I was in such pain and laid on my back. It gave me something positive to keep my brain on. No, I take each day as it comes. As long as I wake up in the morning, the sun's shining, I'm happy. Long-term future, no, I don't think about the long-term future, not at the moment. I'm quite happy with the life the way it is at the moment. I'm grateful for the help and support I've had from friends and the specialist team at Simon, the lung cancer specialist nurse, GP, the nurses on the Macmillan Dales unit at the hospital. They've all been supportive. And going back to when I got diagnosed, 4 days after I got diagnosed, we were having a family party. It was my brother who was celebrating his 50th birthday plus 25 years of marriage, and I just turned around to my father and wife and said, I don't want to go. They both said to me, you are going to take your mind off what's happening to you. So we did go, we had a good night out, and that was the start of my journey through cancer and being diagnosed. And here I am 14, 15 months further on, feeling a lot better with myself, certainly emotionally, and we're going to a family wedding.